Okay, you guys, today we're going to be talking about jowls, lower face laxity, and what we can do to kind of snatch up the lower face if you've had weight loss or you're aging and you're seeing a little bit of jowling, which is kind of gathering of the lower face skin. This video will be impactful for options to kind of rejuvenate that area and to improve that area with multiple different in-office procedures that are non-surgical to improve this area. So lower face rejuvenation is probably the second most common, only to under eye, for the most commonly treated area for patients who I see in my office every day. And I feel that a lot of people are having a lot of weight loss over a short amount of time, or they're just noticing the early signs of aging and wanting to tackle this area sooner than later and be more proactive. So whether you have started to notice the early signs of the pre-jowl sulcus changing or lower face laxity in this area, or you're trying to stay ahead of the curve because you look at your parents or your grandparents and you know, okay, I'm headed that way, I need to do something to prevent it or to kind of counteract it, or you've, a little bit late to the game and want to reverse some of the changes that you've neglected over the past years or even decades. So this video will be for you and comprehensive regarding in-office procedures that we can do to improve this lower face area and lower face skin laxity. So jowls, you guys, what are jowls? The little area here, this is called the pre-jowl sulcus. This is the area of the face that often shows our age just as early as the under eye area, which is the other first area to show our age, because in this area the skin is thinner. But in this area we start to notice the changes that happen with gravity, with constant tension pulling down on our face, and also the changes that happen in our skin, our subcutaneous fat, our muscle, our fascia, and our bone that over time can start having effects showing here first. Now the reason why it happens, it can be for multiple reasons, but as we gain wisdom and have birthdays, of course we lose collagen and elastin, extracellular matrix proteins and fibers that give skin that sturdy, tight, taut structure. And as we lose those proteins, collagen and elastin, we start to notice a little bit of gathering of the skin here. You can sometimes see laugh lines. You can see kind of a delineation of that jawline. Instead of being like a nice linear configuration, it kind of dips in here, or it'll start to lose that contour or that sharpness or that defined look that we once had. And it's not only from the changes that we see in our skin with a loss of collagen and elastin, but also the subcutaneous fat layer diminishes and thins over time. The subcutaneous fat layer lays underneath the skin, and if you think of this skin as like a tablecloth, and you think of like the subcutaneous fat as almost like a padding or a comforter underneath the table, which is actually the hardware or structure, meaning like our bone and cartilage and ligaments and fascia, that is thinning over time too. And some of us are having weight loss and are becoming more fit or leaning out, and that subcutaneous tissue, you not only lose fat in your abdominal section and your mid thighs, your arms, but you also lose it in your skin. And so what happens with the skin when the subcutaneous fat becomes thinner or more depleted or diminished, it can cause that kind of facial laxity, which presents down in the lower face. Doesn't present anywhere as significantly in other areas of the face because of gravity and the tension forces. It just shows up with these kind of like sagging loose jowls at the lower face because of the loss of subcutaneous fat. So we've talked about the skin and the loss of collagen and elastin in the skin. We've talked about the subcutaneous fat and the changes which happen as the subcutaneous fat thins. Now let's talk about the muscle and the fascia, or what we call the SMAS in the face. Now the muscle tension and the ligaments and the fascia, the SMAS in our faces also start to kind of decrease and pull down with time. That's why we go from having like a nice heart shape or round face to more of like an oblong oval face as we get older. And so usually when it comes to the muscle or the SMAS, the ligaments, the tendons, usually that's more plastic surgery, but of course we want to put off surgery as far as possible if we can. I know that there's a trend of having surgery at a younger age. People are having facelifts now in like their late 30s and early 40s. I'm in Orange County, Newport Beach, California, which is where my private practice is. So unfortunately we see this a lot, and younger patients are having surgery earlier, but that's may not necessarily be an option or ideal for many of us. And especially sometimes surgery is not an option for anyone. So I like to go over different things that we can do in the office, which will never compare to a facelift or a surgical correction, but maybe things that can buy you a little bit of time or correct changes on more a skin level or, you know, subcutaneous level than actually having surgery that's going to redrape and reposition, you know, muscle, tendons, ligaments, fascia, SMAS, and things that are a little bit more invasive. But just keep in mind that those ligaments and those tendons and those muscles are sagging with time as well. So that's something, you know, that we have to work against as well. Also, taking it one layer deeper is the bone, the craniofacial anatomy. As we get older through each decade in life, I know I've said this in other videos, but I remember in medical school, we looked at a skull and as like a baby, as like an adolescent, 20s, 30s, 40s, 50s, 60s, 70s, and beyond. And the craniofacial anatomy actually changes as we get older. And so the bone starts to get resorbed, especially after menopause, in our jawline. And so you see resorption of the bone in the angle of the jaw, which is right here, and you start to see resorption of the bone in this kind of lower face area as well. And with time, the skin doesn't have that structural support. The tablecloth doesn't have that table holding it up and kind of draping it where we want it. And so sometimes things like Volux or certain fillers with a high G prime, which we'll get into later in this video, can be used to kind of provide that bony structural support to kind of redrape and reposition the skin and lift it up by almost like a mechanical lifting and restructuring of that skin. Now, I know a lot of us are trending away from filler, and I get it. There's been a lot of unlicensed and not very highly trained injectors doing a bunch of filler, the wrong type of filler, in the wrong dermal plane, doing too much too fast, and we're coming out of this epidemic of people having these overfilled, weird-looking pillow faces. So when I talk about filler in the jawline, I'm not talking about your traditional filler, you know, that we do in the nasolabial folds or the pre-gel sulcus or even in like the temples or in the lips. I'm talking about filler, which specifically Volux, which is a very high G prime. G prime means like a very thick, sturdy filler that goes along the jawline. So it's not going to make you look puffy or overfilled, but it's going to provide that structural support, especially if you're perimenopause or postmenopausal and you've lost that structural support. Once you do a little bit of filler in this jawline, it lifts it up from behind and kind of posteriorly with a beautiful aesthetic. And it's a higher level of skill to inject this filler, so you may not find Volux very readily, you know, in medi spas and, you know, with, you know, more mid-level kind of training. But when it's done in the right setting with the right patient, with the, you know, a very astute clinician, it can really do a lot for just kind of like repositioning that skin with a very beautiful natural contour without looking overfilled. So when I talk about filler for the jawline for lower face laxity, that's usually what I'm talking about. Now, you can talk about biostimulatory fillers, which are, it's kind of a misnomer. I wouldn't call Sculptra or Radius or some of the overseas, not FDA approved in the US, but some of the polylactic acid, calcium hydroxyapatite biostimulatory fillers, I wouldn't consider them actual fillers like you think about, like, you know, Restylane and Volux and Juvederm. It's usually more biostimulatory effects of these injectables, so I like to call them biostimulatory injectables. And usually Sculptra is my favorite biostimulatory filler to kind of fill in the loss of volume in the mid-face, which can actually help lift up on the jowls. Now, every individual patient is different, and some people may benefit more from jawline filler to kind of provide that structural support. Sometimes people will benefit more from biostimulatory filler, which is going to lift up from above. Now, sometimes I'll have patients saying, can I have Sculptra here, or can I have Sculptra in another area, which is going to lift up from here? When you're talking about aesthetics and facial anatomy, there's different cosmetic subunits of the face. And when you're trying to adjust and improve skin laxity in this area, you usually want to go from the mid-face, meaning if you're hollowed out here and you want to do like a more brow lift or upper third of the face lifting, it's not going to affect down here. I have patients ask me that a lot. Well, if I inject here, is it going to just pull everything up? And that's not usually how it works, unfortunately. I wish it did. But if you're trying to more concentrate on the lower face, it would be more of a Sculptra mid-face volume restoration. And these biostimulatory injectables induce your skin's own regenerative processes to make collagen and elastin, extracellular matrix proteins, glycoproteins that help add volume naturally with a beautiful contour and just like global aesthetic improvement without, you know, actually having to inject the jowl, pre-gel sulcus itself. So usually that's my option for patients who want to go like an injectable route. Now, another injectable we can use for lower face laxity is Botox. Now, a lot of people will be concerned or confused, like how does a neuromodulator, when you're decreasing muscle tension or muscle strength, how does that improve the jawline? And this is how. So the way that Botox or any neuromodulator, I'm using Botox, but it could be Daxxify, Dysport, Xeomin, the way that it works by kind of sharpening the angle of the jaw is what we call the Nefertiti lift. Now, in the face and in the neck, all the muscles are antagonistic, protagonistic. They're all pulling and pushing on each other. So the resting tone of the muscles that pull up to give that jawline that beautiful smooth contour is the effect of jawline Botox or the Nefertiti Botox lift. And the way that that works is you just inject, it's usually like 10 units per side, and it's usually 4 or 5 injections with a teeny tiny needle. I use a 33 gauge needle because that's the smallest available needle on the market, not very uncomfortable. And as you inject along the jawline, it knocks out those muscles that are pulling down. So the resting tone of the unopposed muscles kind of pull up and snatch up the lower face. You can also do it in the angle between the chin and the neck here to kind of like snatch up this, we call it this submental area. And that gives a beautiful aesthetic look. Now, Botox traditionally only lasts about 3 months in most individuals. If you work out a lot, or if you're like me and you work out 5 days a week, sometimes it doesn't even last 3 months. Daxxify is another great neuromodulator that usually has a more extended duration of time when it's having the effect. So I usually do Daxxify along my jawline and my submental area about twice a year, and that's all that's needed because that's such a long-lasting neuromodulator. Now, if it's your first time having jawline Botox or doing the Nefertiti lift, I would basically just start off with Botox to kind of test drive it, or Dysport or one of the less longer acting neuromodulators. See if you like it, and if you like it and you're comfortable with your provider, then you can move to something more longer lasting like Daxxify. But usually out the gate, you don't want to start with Daxxify because it lasts for such a long period of time. You want to make sure you like their results first, which I'd be very surprised if someone didn't like the results, but it's very injector dependent. So if you go to somebody who's not that great of an injector, you don't want to be stuck with like a result that you don't like. But Botox along the jawline and the submental area can really do a lot for just kind of contouring out the lower face. We also have DAO Botox, and DAO just stands for the depressor anguli oris muscle, and that's a muscle that connects from the corner of the mouth to the lower face, the lower jawline, and it pulls down and contracts as we gain wisdom and have birthdays, and it can make us look like we have a RBF or a resting face. And so what happens is when you do a little Botox here and here, it decreases the tension and the contraction of that muscle, so it kind of floats up the edges of the mouth. So that's the other area that we commonly use to kind of improve this lower face laxity with beautiful results that can be aesthetically pleasing without changing your face too much and still looking like you. So let's talk about in-office procedures using devices. Devices are my favorite. I'm a laser girl, and lasers are collimated light in a specific wavelength that can help resurface the skin, improve fine lines, wrinkles, stimulate collagen. Those are lasers, light amplification by stimulation of emission of radiation. So not to get too nerdy or scientific, but people often confuse lasers with energy-based devices. Energy-based devices like soft wave, Ultherapy, Thermage, those are energy-based devices that use heat in some form of energy, and it could be monopolar, bipolar, radio frequency, microfocus ultrasound, microwave. There's different energy forms, but basically what happens is when energy in the form of heat gets put into the skin, it stimulates the fibroblasts, which are the collagen producing cells, to make more collagen. Anytime you have more collagen in the skin, things are tighter, firmer, smoother, and trust me, I've done Thermage 4 times in my life. I'm 47, and I did Thermage when I was 30, 35, 40, and 45, just in this area, lower face area, and it's one of the best treatments when it's done correctly with the most updated platform, and it could just really do a lot for the lower face. Now, Stephanie, my amazing laser nurse and device specialist, she actually trained with me. We've been together for over 10 years. She's done my Thermage treatments on me, and the way that we do it is a little different protocol, but if you look online and you see negative comments about Thermage or some of these heat-based devices, remember there are a lot of spas, unfortunately, out there, and I only know this because they're talked about at our academic meetings, that are unlicensed and that are buying used, refurbished, old models. For example, Thermage has been out since I was like in medical school in the early 2000s, and they're buying these old models that go too high, temperatures that should not be achieved because they can melt fat, and you combine that with a untrained mid-level who's doing these procedures, it can wreak havoc and have catastrophic outcomes with melting of the fat, less than desirable outcomes. But when you have the updated software and someone who knows what they're doing, Thermage, especially of the lower face, can do a lot. Not only for my more mature beauties who have never had anything done and are kind of wanting to, rewind the clock, it does a great job for just stimulating collagen and tightening that area, or for my more premature beauties who are just trying to stay active and on top of it. How I was when I was in my late 20s and early 30s. I wanted a collagen bank. I know now it's a thing, but back then nobody was really doing it, but it just made sense to me in all of my aesthetic lectures and, in all of my dermatology didactics. I'm like, wow, I want to do these biostimulatory treatments at an early age, so as I lose 10% of my collagen each decade, I have reserves that I'm building on. So whether you're younger and you want to be more proactive, Thermage for the lower face to kind of prevent the jowling is a great treatment. Or if you're older and you're late to the game and already have existing jowls and lower face laxity, it can also make improvements there. Now, of course, it's not going to give you the results as like a facelift will if you're severe enough, but it's something that you can do to put off surgery, or even if you plan on having a surgery or facelift or neck lift, your surgeon's going to be operating on skin that has more collagen in it, and that result always will last longer and have a better outcome than skin that is collagen depleted. So especially in my perimenopausal and postmenopausal beauties with a collagen depleted skin, this is a good way to biostimulate your skin to make that extra collagen that's been lost. So that's one of my favorite treatments. Thermage is one of my favorite device treatments that is not painful. Results last about 5 years. The collagen half-life of the Thermage results last about 5 years. I see people saying, you need to do Thermage once a year. I just don't feel that that's necessary when it's done the right way, and sometimes, they may be overselling it to you, but honestly, every 5 years, Thermage, lower face, one of the best things I've done, and one that I definitely recommend for my patients, regardless of age. Now, some people will say, oh, Dr. Capel, I'm 75 years old. Is it too late for me to even stimulate collagen in my skin? And absolutely not. I say this all the time in my videos. Skin is a very responsive, dynamic organ-based system. So just like the muscles, when you stimulate them at the gym and you lift heavy weights and then you drink your protein afterwards and you eat clean, it's responsive. Now, if you stop going to the gym and you're, say you get sick or you're hospitalized and you have that muscle wasting, your muscles will thin out. Then you go back to the gym and you stimulate it again. The skin is the same. It's very responsive to stimuli. Now, whether it's heat or a laser or a new skincare active, your cells are going to always be changing and responsive to stimuli. And you want to stimulate your cells to act and behave like they did when you were younger. And that means producing a lot of collagen and elastin. And that's a more natural looking result because you're inducing your skin to do the work. You're not passively cutting and suturing or injecting like a filler in there. You're basically inducing your skin to act and behave younger, because cells become senescent. Even after 20, our cells start to slow down and stop producing these proteins that they made when we were younger. So when you can stimulate them to do so with long-lasting effects, I feel that it's one of the best things we can do in aesthetics. Now, a lot of people will ask about Thermage and hyperpigmentation and if it's safe in skin types, and that's another reason why I love Thermage. It's safe in all skin types. It's not painful. You shouldn't use any numbing when you have a Thermage treatment. If you go somewhere and they're using numbing, that should be a red flag, because you want that biofeedback. If it's too hot, you can tell your provider, hey, this is too hot, I'm not tolerating it well, and they can turn it down. It's when people are like numb and they crank the machine up, they're using a device from 2007, they're not really respecting the windows of temperature that you need to be into to effectively stimulate the fibroblast cells to make collagen, and it just is like a recipe for a disaster. So Thermage, safe for all skin types, no downtime. You can walk right out of the office after treatment, go have lunch with your friends, nobody's gonna know anything was done, and results last for about 5 years. So it's one of my favorites. So usually when patients come in for lower face laxity, say we do a little bit of filler, or say we do a Nefertiti lift, or say we do some Sculptra, I always recommend everybody doing Thermage just to collagen bake, because you'll never go wrong with having more collagen in your skin. Okay, let's talk about my other favorite tightening device. Is it in here? Oh yeah, Ellacor, this little baby right here. So Ellacor is a microcoring device. So it is kind of like microneedling, but you guys know how I feel about microneedling. People always have find a microneedling option that's not a package. The reason why people do microneedling in packages is because you're gonna come back because you're roped into some package because it doesn't produce results. As far as I've seen in my office with patients who have it done on the outside, I've actually had every microneedling device since 2014, and I've been less than impressed when it's compared to other devices like Thermage, Ellacor, lasers, CO2, erbium. There's so many other better options out there that are not going to risk causing atrophy, pox like acne scarring, hyperpigmentation, hyperpigmentation, and less than desirable outcomes as we've seen with microneedling. Now, I'm sure that there's some of you guys out there who have had great results from microneedling. Usually it's younger patients, and usually, a lot of treatments would produce results like that, especially when you're younger and you're more responsive to treatment. But microneedling is not my favorite, but microcoring is different because you're taking cores of skin out. So basically what happens, instead of having microneedling needles, those needles are open bore, and they're basically excising little columns of skin out. And what that does is it shrink wraps the skin. So Ellacor, when it first came out, I did the clinical trials. I participated in that like back in 2017, 18, and the device was a lot more powerful. Now you need to do about 3 treatments to get the results what we used to get in one, which is fine. It's a safer profile for the device, but it's great for my beauties who have lower face laxity and kind of like gathering, like when they smile, they have those little like accordion kind of wrinkles in this area. Thinner skin, more mature patients, and usually a Fitzpatrick skin type 1 through 3. It's not FDA approved in darker skin tones because of the risk of hyperpigmentation. Now, sometimes you can have erythema or redness after the Ellacor, but usually we just do a little V-beam laser and that just takes it away. And V-beam also stimulates collagen, which is like a win-win. So usually when we do Ellacor, it's usually lower face. You can't do Ellacor on the forehead or anywhere else. We do it off-label on like the neck, abdominal area for my mamas who have thin skin after babies, or like volar surface of the arms. We do it on the body off-label a lot, but for the face, it's FDA approved to improve moderate to severe fine lines and wrinkles of the lower face. So Ellacor, unlike some of the energy-based devices or lasers, doesn't stimulate collagen. It does a little bit, but it's more just like excising skin. So when someone comes in to see me and we're trying to decide, are you like an Ellacor or a Thermage or more of a laser candidate, I work with each individual patient regarding their skin thickness, their skin types, the ages, the changes with aging that they're experiencing. So what one candidate may be better for Ellacor and one may be better for Thermage, or sometimes it's a mixture of the two, and it all just depends. That's the art of medicine. It's the art of aesthetics and practicing dermatology, is that not every person is going to be this cookie cutter menu that we do the same thing on everyone. So for those who are candidates for Ellacor, microcoring, it's a great device, and I've been very, very impressed with the results, and patients are always happy. So let's talk about lasers. So lasers, as we talked about earlier, are wavelengths. They're photons. It's collimated light that's going to resurface the skin. So when you think of skin on cross-section, you see the epidermis and the upper layer of the skin, and then you have the dermis, and then you have the subcutaneous fat. So up here, lasers are where we stimulate collagen to help smooth fine lines and wrinkles, but it's very superficial. Thermage and energy-based devices are down here. So sometimes we'll do a full thickness treatment, and that's called thermofrax. It doesn't have to be Thermage and Fraxel, which is what thermofrax is. It could be Thermage with CO2 or Thermage with erbium. Erbium is a very powerful laser that's like my new baby, and a device that's very powerful, but can do a lot for skin tightening and rejuvenation, but more superficially. So when you think lasers, think resurfacing. It's like taking sandpaper and resurfacing a textured surface. It's going to make it smooth it out, stimulate collagen, shrink pore size, and also correct for hyperpigmentation, brown spots, sun damage that's more superficial and visually apparent. But when you're talking about energy-based devices, those are a deeper tightening kind of stimulatory effect on the skin. So lasers are more superficial. So for lower face laxity, I wouldn't recommend like a laser if you really need to like tighten and lift. It will help with, like, for example, the Puta orange or like textured chin. Sometimes we'll see kind of more pores or texture on our chin area. So like an erbium or a CO2 or even a Fraxel can help with that. But you wouldn't use like an erbium or a Fraxel to like snatch the lower face up. So hopefully that will kind of make it a little bit clearer with the difference between the different devices. But they all kind of come together, and when you do a little bit of everything or kind of pick and choose what treatment might be best for you, you get the most well-rounded, more natural, beautiful outcomes. So that's how lasers play a part into lower face laxity. Not really for tightening, but can kind of just finish the job. Icing on the cake, putting fresh sheets on the structured bed that's nice and refurbished. So that's how you can kind of think about lasers, but not probably my go-to for tightening, but for resurfacing and smoothing out the contour and improving the texture of the skin, knocks it out of the park. So for the sake of completeness, if you see right here, I have an Emsculpt. Emsculpt is great for booty volume, biceps, triceps, quads, abs, and it's a great muscle building treatment. Now there's one called M-Face that I know people are going to ask me about for lower face. M-Face isn't my favorite because it's just kind of counterintuitive. We're using Botox and neuromodulators to kind of relax wrinkles and inhibit muscle movement, but then you're going to do an M-Face treatment that's going to enhance muscle movement. So just speaking from like a physics standpoint and anecdotal evidence that's presented at meetings, I'm not a huge proponent of M-Face, but if you've had one or you have a provider who's recommending it to you, for all intents and purposes, have at it and share your experience with us in the comment section if you've had it. Other treatments that we could talk about for lower face laxity, I'm about to start clinic in a few minutes, but want to not forget anything. Okay, PDO threads. PDO threads are a procedure that I perform in my office very regularly, but it's not my first line treatment. Usually if someone comes in and they want to snatch up the lower face, I'll recommend other treatments before going to threads. Threads are kind of like the last resort because it's a long run for a short slide. They don't last as long, and oftentimes you can have complications with them poking through or being noticeable, and I feel that it's almost a biostimulatory component of the threads that gives more meaningful results than the actual mechanical lifting of the threads. So when you do thread lifts, it works by two mechanisms of action. It lifts, tightens, and pulls by mechanically lifting up in the skin, but it also is like a slow depot of filler. It's like polylactic acid. It's going to stimulate, the skin to make more collagen and elastin. So not only do you get like a lifting, but you also get like a more full effect and collagen stimulation effect as well. But again, thread lifts, I love them. They have their place, but it's not usually my go-to first line treatment, especially for lower face laxity. Now, things we could do at home for lower face laxity. Now, once the jowls start to show, and once we have thinning of the skin, thinning of the subcutaneous tissue, and the craniofacial bone resorption, things like that, there's not really much you can do at home, but things over a lifetime can make a huge difference. And these are the things you guys all know: eating clean, decreasing stress, working out. Now, I should show you a picture of the pillow that I sleep on. It's like a cervical spine injury pillow, but it keeps my head kind of in a position to where you're not straining or kind of tweaking your head in a certain way that can, accentuate lower face laxity and neck laxity as well. It's actually a very comfortable pillow, so I'll kind of tag it in this video. Again, I'm not sponsored. I don't get any kickbacks for any company, nor do I ever want that, because I want to be able to just recommend what I use and what I recommend for my patients for all you guys out there too. But things like facial yoga, gua sha can actually help those who have more fluid accumulation in their face. So say you go out for a night and you have salty foods, or say you have a fun night with your girlfriends and like the next morning you wake up and you're puffy in the face. Doing gua sha can kind of help with lymphatic drainage and can define and sharpen the jawline as well in certain people. Usually it's younger people, usually it's younger patients, but it can make a big difference for lower face laxity and kind of accentuating that lower face jawline area. Now, Kybella, which is deoxycholic acid, I'm kind of jumping back into in-office procedures. We don't usually do that here. It's higher risk. It can demyelinate the nerves. It can have deleterious side effects. But for lower face fullness, it can actually help accentuate lower face, not laxity, but can kind of help contour and define the lower face a little bit more. So jumping back to at-home procedures that you can do, or at-home habits that we can practice daily: facial yoga, gua sha, eating clean, decreasing cortisol levels by getting plenty of sleep, exercise, decreasing cortisol levels by meditating or stress, and good sleep hygiene. These are all things that will come into play and will help slow down the aging process, the slowing down of like the breakdown of collagen and elastin over a lifetime as well. So those are things that you can do at home. I know a lot of people people are gonna ask me about at-home devices like NuFace, which uses like an electrical current to kind of stimulate muscle contraction of the lower face. I find that I'm not a huge proponent of it because as a dermatologist, I feel like longer lasting treatments with longer lasting effects are more beneficial than like at-home procedures, but I fully, support those of you who use at-home devices if you're okay with having to, repeat the treatment every 24 hours. And, I know it could be, for the consumable, it could be a little bit costly for buying the gel that you have to use for the device to work at home, and that can add up over time. Sometimes I feel like it's better to save your money and do an in-office procedure that's gonna last a long time that you don't have to worry about, expiring after 24 hours and having to do it every day and, consuming many hours of your life, in the bathroom doing the microcurrent or NuFace or any at-home devices. But again, not gonna knock it, nothing against it. If you guys choose to use at-home devices and it works for you, that's something that we can do at home too. So maintaining your fluid status, ironically, when you're more swollen, drinking more water will help decrease the puffiness and the swelling in the face, and just maintaining, a good hydration status overall will help minimize, kind of like a fullness on the lower face as well. Unfortunately, jowling, once it happens, it's not really something that you could reverse at home, and even as a dermatologist in the office, things are skin deep that we do. Collagen and elastin stimulation is going to tighten the skin. It's not going to do anything to the muscle, to the fascia, to the SMAS, or to the bone, but we can kind of offset some of those changes. And then sometimes you get to a point where surgery is needed. Now, if that's an option for you, just going to a very, highly trained, astute plastic surgeon who specializes in facial rejuvenation is really important. I always tell my beauties to at least get a second and third, even a fourth opinion, because it's your face. You're only, you're kind of limited. You only have a few chances in life to have a facelift. And the treatments that we've talked about in office, regardless of what some plastic surgeries say online, do not preclude you from having surgery in the future. So I know that there's a lot of fear mongering out there. Let me tell you, as a dermatologic surgeon and as a non-surgical dermatology aesthetic provider, that is just simply not true. And those plastic surgeons want you in the OR. They don't want you doing minimally invasive procedures. So just keep that in mind. But if you do come to the point in your life where you do want surgery, make sure that you get a second or third opinion. I know the trend is having surgery at a younger age these days, but just remember, once you have surgery, you can only have, maybe 2, maybe 3 facelifts or lower face surgeries in a lifetime. So you kind of want to save it for when you really need it. Now we're also seeing a lot of like a la carte surgeries, just isolated neck lifts, or say someone just has laxity in the lower face, isolated lower face lifts, or like I had done just 1 month ago, my lip lift surgery. So you can kind of do a la carte blepharoplasty, lower blepharoplasty, lip lift, neck, lower face lift. You don't have to have the full, let everything go. What you don't want to do is just neglect everything until it's too late and just have this huge surgery where you're doing like brow lift, upper, lower face lift, neck lift, blepharoplasty, lip lift, all at once. You kind of want to see where you're aging and what the changes are happening in your face and just target that area. And save those bigger procedures for when you actually really need them, when you're a little bit older or when you're in a time in your life when surgery would be a better option. That's my best advice. Now I know, speaking of lip lifts, since I brought this up, so I want to show you guys, because I got a lot of not so nice comments on my previous videos about my lips not moving. So it's been almost like 1 month and I think 1 or 2 weeks since my lip lift surgery. This is my second time having it, and the first time around I didn't Botox afterwards, and I was trying to force my mouth closed a lot after my first lip lift surgery, and I feel like that's why my results didn't last very long, and that's why my scar spread a little bit. So Dr. Rossi, who's an amazing plastic surgeon and a good friend of mine in San Diego, he did the lip lift surgery, and before my lip lift we Botoxed this entire area. So I purposely would prevent my mouth from moving too much and stretching out the scar. So I know you guys are going to want to see my scar. So here's my lip lift scar. He did an amazing job. You can barely see it. He did such a great job, but I am completely Botoxed here, 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 and so I can't, if I really tried to, I could force my mouth closed, but I'm intentionally trying not to move my mouth to protect my results, because again, it's just been several weeks since my surgery, and I care what this looks like 1 year from now, 2, 3, 4, 5 years and beyond. I don't really care about what it's looking like now. So my upper lip is moving weird and that bothers you, just know that this is intentional. And as much as I love you guys, I'm not gonna like compromise my surgical result to look more normal on YouTube. I just wanna get this content out for you guys each week. So that's my lip lift story. I know I look weird, but it's in the end for the greater good. So that's why I'm moving my lips weird. All right, you guys, so leave a comment in the comment section. Let me know what you guys wanna hear about next week, and also treatments that you've had on your lower face, if you've had dramatic rapid weight loss, what you're doing to kind of offset that, things that have worked for you, that have not worked for you, recommendations for other beauties who follow this channel. And as always, I love you guys, and I will see you next week. Lower face laxity. Thank you so much for watching. Drop a comment in the comment section and share this video with someone who may find it useful. As always, I love you guys.